Now, in the fifth and final section of our lecture, we will talk about the premenstrual syndrome. In this premenstrual syndrome, we will talk mainly about what's the pathophysiology of premenstrual syndrome, what's the treatment of premenstrual syndrome, and suppression of ovarian cycle. So first, what is premenstrual syndrome? Pre, like the name shows, before menstrual cycle begins. So these are some signs and symptoms which patient feels or present with before the menstruation begins. So it's psycho, neuro, or endocrine disorder of unknown etiology. Cause is not known, but psychological factors and some endocrine imbalance or hormone imbalance that's taking place before the menstrual cycle are responsible for this premenstrual syndrome, and it is just before the menstruation. So some common symptoms related to premenstrual syndrome are usually patient feel very bloated and there is retention of fluid. So retention of fluid leads to bloating, breast tenderness, swelling of the extremities, weight gain. So these are very, very common. Lot of females before the menstrual cycle, they feel the weight gain, they are feel bloated, and they have breast tenderness present. The neuropsychiatric symptoms include irritability, depression, crying spells are very common. The patients, they cry without any reason, so crying spells are common. There are mood swings, forgetfulness, restlessness, and increased appetite. Also, there is anxiety, tension, headache, anger. So all these are very common features of premenstrual syndrome. Some behavioral symptoms include fatigue, dyspareunia, tiredness, insomnia are all common. So these are the symptoms of the premenstrual syndrome. No, not related to any organic lesions. There is no organic pathology associated with premenstrual syndrome. Mainly it is due to endocrine abnormalities or endocrine disorders or imbalances before the menstrual cycle. Regularly occurs during the luteal phase of each ovulatory menstrual cycle. Symptoms must be severe enough to disturb the lifestyle or before she requires any medical help. Some patients really have a bad premenstrual syndrome and they need some help, especially psychological help when they have really bad depression or mood swings or crying spells. They should get some help and they should get some light medicines to relieve the anxiety and depression phase of the premenstrual syndrome. Symptom-free period during rest of the cycle. So it's mainly associated with the menstrual cycle. And then there is also premenstrual dysphoric disorder. Dysphoria or forgetfulness is also common. Pathophysiology, alteration in the level of estrogen and progesterone. As I mentioned, it's mainly due to hormonal imbalances that occur before the menstrual cycle. So alteration in the level of estrogen and progesterone. And then also some other factors like serotonin, endorphins, and gamma aminobutyric acids. These can also lead to premenstrual syndrome. Psychological and psychosocial factors. Thyrotropin releasing hormone, prolactin, renin, aldosterone, prostaglandins, and others. So if you notice, all these are the different hormones and neurotransmitters which are produced by the body. All these are disturbed or their secretions is altered, that can lead to all the symptoms that are associated with premenstrual syndrome. Then treatment is lifestyle modification, cognitive behavior therapy, and then non-pharmacological assurance is important. Yoga, different stress management, diet manipulation, avoidance of salt, caffeine, and alcohol. These are the some yoga exercises that can be helpful to treat the premenstrual syndrome. Then non-hormonal is tranquilizers or antidepressant drugs, pyridoxine and diuretics, mainly diuretics to relieve that weight gain and fluid retention. Then anxiolytic agents, selective serotonin reuptake inhibitors and noradrenaline reuptake inhibitors, fluoxetine. So all these are the different treatment options that can be tried for the premenstrual syndrome. But lifestyle modification is very important because drugs you cannot use for a very long time. All the drugs have side effects. So lifestyle management, dietary management, some exercises that can help, and patients should understand that this is some period if they can manage this thing psychologically or by behavioral management, that will help them. So otherwise, if the condition is really bad, and it's affecting the daily life of the patient, then there are also treatment options are available that can be tried. Then the drugs for premenstrual, the hormonal therapy, oral contraceptive pills are effective for premenstrual syndrome to overcome that hormone disorders or hormonal changes. Progesterone, spironolactone is drugs that is a diuretic. It can bring the blood pressure down, but in this condition it is used for reduce the body weight and also affects the aldosterone. Bromocriptine. Then suppression of ovarian cycle is by usually the danazol. Ovarian cycle, suppression of ovarian cycle. Usually the ovulatory cycles are painful and they have usually the premenstrual syndromes, and they have usually dysmenorrhea more commonly. So if the suppression is required, then danazol is the drug that can be used. And then also gonadotropin releasing hormone analogs to assess the role of ovarian steroids in the etiology of premenstrual syndrome and predict whether bilateral oophorectomy would be of any help or not. So this is another treatment option. Oophorectomy or removal of the ovaries, and especially if the patient's family is complete and they don't want to conceive anymore, oophorectomy can be tried. So that was all about the dysmenorrhea. We talked about primary dysmenorrhea, secondary dysmenorrhea. Then we talked about the causes and treatments of the dysmenorrhea. And then we talked about the syndromes of the menstrual cycle, Mittelschmerz and pelvic congestion syndrome. And then we talked in detail about the premenstrual syndrome and how it can be managed or treated. So hopefully you learned a lot about this topic. After this lecture, you should not have any problem in understanding the topic of dysmenorrhea. So thank you for watching sqadia.com.